join the session today because it is a rare opportunity, and you can learn from other professor from other university, especially from the foreign country, and because I think it will be a great opportunity and your knowledge by this way, by joining this kind of session. So before we start the lecture, first I would like to give the time for our Dr. Iwan Sosial Hamid to give the opening speech and maybe do the opening remarks. Dr. Iwan, time is finished.
Yeah, thank you, Dr. Mirza. Good morning, ladies and gentlemen. Welcome to the session in Faculty. Thank you very much for the speaker and for participants for your willingness to join this session. It's very good to see all of you and very happy and healthy. First of all, I will introduce myself. I'm Iwan Sosial Hamid, as a Vice Dean for Human Resource, Finance, and Facility in Faculty of Medicine. I would like to associate our speaker, Professor it's important to improve our experience. We have joined our knowledge. I hope we will be able to and next event. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Iwan, and we'll mark our and later we'll be handing over this session to our moderator, Dr. Lina Susanti. Dr. Lina Susanti is a teaching staff in our and Division of Veterinary Clinical Science, and also Dr. Lina got his PhD degree from the Seoul National University. Dr. Lina will guide our session today, and I will hand over the time and screen to Dr. Lina. Please, Dr. Lina, the time is yours.
Okay, thank you, Dr. Mirza. It's very nice to see everybody this morning. So, the Honorable Vice Dean of the Faculty of Veterinary Medicine, Universitas Airlangga, and Son Won Kyun Kyusunim, Annyeonghamnida. Okay, so I will introduce the profile of Professor Son Won Kyun just briefly. So he obtained the veterinarian degree from the Seoul National University in 2007 and the PhD in 2015. And since 2007, he has been working in the Department of the Anesthesia in Seoul National University Teaching Hospital, and I mean Animal Teaching Hospital. And he has been participating in the translations of 3 veterinary anesthesia books. One is the veterinary anesthesia, and then we have the veterinary emergency and critical care, and also the veterinary pain management. And he has been the author for 30 papers on the peer-reviewed journal in veterinary anesthesia. And right now is the academic committee vice chair of the anesthesia department in the Korean Society of Veterinary Surgery. So his current interest in research is ultrasound-guided local block techniques and drug delivery system for local anesthesia. And so without further ado, Professor, the time is yours.
Thank you for introducing me. Okay, can you hear?
There.
Yeah. Maybe interest in person is very important. Maybe money. I'm glad to be here with you today. The topic of my presentation is current techniques of local block. Although I have little experience in large animals, including cows, horses, goats, and sheep, but my patients are almost dogs and cats. So this lecture includes only small animal contents. Before initiating, I have some questions. Is there any guys or ladies having the experience of anesthesia if you work in the field of anesthesia even sometime, please let me know how much the people.
I'm sorry, Professor. Can you repeat?
Could you tell me how many people have the experience of anesthesia in this lecture? In the listener.
Okay, maybe for the listener who commonly perform anesthesia or routinely perform anesthesia, you may raise your hand so the professor will know. But before that, I think many veterinarian attending here are clinicians, so they will have many experience or many patients in which they need to perform anesthesia, Professor.
Okay. Yeah. I'm sorry for those anesthesia people. Anesthesia is the worst and the most stressful task, which is proved based on the highest suicide rate among various divisions in animal and human medicine. And that happened to be my major. I didn't know at the time. Okay, let's start. The major stress is due to the anesthetic mortality, patient, operation, and anesthesia. These are influencing factors of perioperative death. What's the major influencing factor among them? Anesthesia. In human medicine, the anesthesia is the lowest position of human medicine have specialty of anesthesia. Does anyone happen to have a board member of anesthesia here? ACVA, ECVA, if could you help me? In 1950, at the initial period of anesthesia anesthetic board, the anesthetic mortality of humans was similar to dogs. By now, were higher. Specialization have reduced the mortality. So today's content is about specialization of local anesthetic technique. The steps of anesthesia, including unconsciousness, muscle relaxation, analgesia, is generated by CNS block, which depress every organ functions related to the CNS. The organ function can cause real damage in critically ill patients without residual capacity of vital organs. General anesthetic agents generated general depression. So Sparing or reducing requirement of general anesthetics is better for stable and safe anesthesia, which is called balanced anesthesia. As you know, on the balanced anesthesia, local anesthesia is more special compared to systemic sedatives and analgesics. This famous table expresses body responses according to the anesthetic depth. Traditionally, proper depth has been medium plan 2 of stage 3. In critically ill patients with minimal or no residual capacity, however, light anesthetic depth can be recommended because of minimal cardiopulmonary depression. And the response to surgical stimulation should be handled by local anesthesia, should be. That can be or maybe, because almost all anesthetic agents, sedatives, analgesics cannot completely control the cardiopulmonary reflex and motion against somatic pain caused by surgical stimulation, except for local blood techniques. Let's think for a moment about score of local anesthesia in our clinic, not yours, in our clinics. In Koreans, we have only lidocaine as local anesthetics. I can give the 20 score. We apply only infiltration techniques in the surgical case. At least one more nerve block technique is used for surgical operation. When performing local block, we expect complete nerve block at whole surgical site, if not too bad for patient or me. For the post-operative anesthesia, we use techniques of wound catheter infusion or commercial products for longer effect of local block, such as Nushta is a drug delivery system for extended drug release. Think about the score in your clinics. Here is the pre-operation room in our clinics. My team is 16 years old, and probably the score of local anesthesia is between 60 and 10 points, 100 points. We are trying to reach 100 points. These are nerve block techniques used in our clinics, SN Seoul National University. Regional nerve blocks as well as infiltration can be used in every surgical operation. Complete or partial nerve block reduce the requirement of analgesics, sedatives, and anesthetics. This patient is a surgical patient, and this moment is after surgery. Complete nerve block support post-operative rest even without any systemic analgesics. At the aerosol timing, there is no screaming and no agitation, just like waking up from sleep. However, in incomplete block, in particular, uneven block sometimes cause sudden and sharp alteration in cardiovascular vitals, motion, and considerable stress of anesthesiologist. The most important things for accurate nerve block is knowing nerve anatomy and dermatomes. Without these, any advanced equipment would be meaningless. The nerve block technique has been developed in order of blind nerve stimulator guided, and ultrasound guided. The development aims to inject close to the target nerve without damaging the vessels and nerves. In other words, accuracy. Another side of development is for longer duration. Bupivacaine is the longest acting local anesthetic agent, about 3 to 10 hours, and the duration is too short for post-operative acute pain management. So, catheter allows repeat injection. However, the catheterization can cause longer hospitalization and requires more resource. So in addition, there are always risk of infection. These days, drug delivery system can be used for controlled or extended releasing of local anesthetic agents. In animals, the famous drug delivery system, it can called DDS, is liposomal bupivacaine. However, this drug is not used out of USA due to refrigerated transport. So in our clinic, we use another DDS, can called hydrogel. I will explain about counterpart. This video is related to the epidural anesthesia. Considering anatomical landmark, epidural anesthesia is typically performed by blind approach with pop sensation, hanging drop technique, loss of resistance, and less injection pressure. However, in case of high obesity or pelvic pressure, the blind technique can be failed. Oh, I'm sorry. So this video shows weak tail twitching when the epidural needle is past the ligamentum flavum and the needle tip is reached to cauda equina nerve. Using nerve stimulator can support. Can you see the weak? Okay, using this nerve stimulator can support the education of epidural technique. Also, we can use US guided epidural anesthesia. This image showed the epidural anesthesia in the machine of ultrasound. You can see the epidural space. Here, and here is disc. The needle is inserted to the epidural space. Here is the ligamentum flavum. And the needle is inserted to the epidural space. Furthermore, injection, the best method is combined guide of ultrasound and nerve stimulator. It's a process of sighting nerve block
야? 잘 보소. 강도. 죽여라. 예. 지금 처음 있는 수는 아니고 안 보이네.
Block of pelvic limbs require two-way nerve block of femoral and sciatic nerves. Sciatic nerve is the best for visualization on ultrasound image. This big nerve consists of common peroneal and tibial nerves, so this nerve complex is easily observed, although the function of US machine is relatively low. This red point is for blind technique, but a greater tensor and iliac tuberosity of this point make bone shadow on ultrasound images. This point is This point is for blind technique. So this line is suitable for US guided approach. In fact, lots of modified US guided approach are studied in small animals. Here is the nerve is here. The nerve is the hypoechoic point, and the injected local unsaturated solution was observed like this.
요것과 요것이 이제 뼈가 되겠고요.
Here is the site for blind approach of nerve block, and you can see the bone shadowing.
레벨에서 초음파 가이드를 하지 않고 제가 한번 설명을 잠깐 드렸지만 아래쪽으로 내려와서
As going further down, sciatic nerve is revealed between big muscles as to the hypoechoic point,
키도 쉽고 잘 보이는
like nose of pig. The needle is advanced to the target nerve.
강력이 0.5 강도에도 반을
You can see
시신을 다 있고
tiptoe twitching at 0.5 milliampere intense. Under 0.3 milliampere intense, muscle twitching cannot be observed, even if the needle tip is inside the target nerve.
신경을 줄여놓고 체를 넣어주시고
Local unsaturated solution spread around the sciatic nerves.
감싸주십니다.
So you can see isolation of the nerve. Femoral nerve approach is more difficult in terms of anatomy and visualization on ultrasound image. In blind approach, femoral triangle is a landmark which is made up of psoas major muscle, sartorius muscle, and pectineus muscle. At this point, the femoral nerve is superficially located. Femoral artery is palpated, and femoral nerve is laterally located compared to the artery. But this complicated structure make it difficult to distinguish from other nerves and vessels on ultrasound images. Inguinal view provides femoral artery, femoral vein, and this arrow point is the femoral nerve. in recent study of ultrasound guided approach, upper site of femoral nerve within psoas major muscle is the new target of modified approach. Femoral nerve was passed through psoas major muscle to femoral triangle. To find the nerve block, to find femoral nerve within psoas major muscle, external iliac artery is helpful.
이게 사실 잘 만지면 생체에서도 충분히 만져지는 부분들이고요. 이걸 만져서
You can find the psoas major muscle with palpation. At the iliac artery level, the femoral nerve is observed by white arrow. According to the patient size and quality of US machine, femoral nerve may be invisible. In this case, we need the help of nerve stimulator, or you can blindly inject into the psoas major muscle. You can see the tiptoe. Next, if you have US machine with minimal function, such as portable, you may not find target nerve. In my cases, sciatic nerve is always visible regardless of US machine type. Anyway, minimal US machine is suitable to find target plane between muscle layers as well as target nerve. Nerves of abdominal skin is innervated through transverse abdominal plane. Hypoechoic muscle layer is easily distinguished, and transverse abdominis plane can be approached through external and internal oblique muscle layer. Transverse abdominal plane block, you can call it TAPB, is typically used for total mastectomy with intercostal nerve block. For the midline incision, rectus sheath block can be used. Based on the xiphoid process, belly button, local anesthetics is injected at 4 injection point.
요쪽 허리 쪽, 제 척수 paravertebral transverse process.
This video is the process of TAPB, transverse abdominal plane block. In lateral recumbency, you can see, you can palpate transverse process, and the muscle layer start at this point. You can see subcutaneous lipid layer, external, internal, transverse abdominis muscle layer. When the needle is penetrated through fascia, a pop sensation can be felt. Before injection of local anesthetics, normal saline can be used for correct insertion. Injected solution spread between muscle layer. Next is drug delivery system. Recently, drug delivery systems is on rising period due to their slowly releasing mechanism. Among them, research on nanoparticles is being actively conducted, and through this system, the blood concentration of local anesthetics can be lowered, and a longer pain relief effect can be expected. among nanoparticles, this is the hydrogel. This type is used in our clinics. Hydrogel hold on the combined anesthetic and then secretes them little by little when it is decomposed by various stimuli. Also, hydrogel is mainly composed of hyaluronic acid and therefore biocompatible. However, it is difficult to inject through syringe due to its thick texture, because the texture is like gel. So this hydrogel is a temperature responsive hydrogel. Which becomes liquid at a lower temperature and a gel form at a higher temperature. When using temperature responsive hydrogel, the combination with anesthetics can be injected as a liquid form, and then inside the body, it turns into a gel form and slowly decomposed, secreting the anesthetics. When using DDS, you can see the extended drug duration. So the red bar means only using bupivacaine, and the upper bar means the combination of bupivacaine and thermal responsive hydrogel. According to the stimulation type, we can see the 2 times of duration compared to the only using bupivacaine. So in case we can see the stable patient status without systemic analgesics or sedation. Listen, patients. Oh, I'm sorry.
그리고 한번 만져봐 주실 수 있나요? 물리되지 않은 선에서.
These patients have a TPL surgery. Although touching the at the surgical site, there is no pain reaction. Actually, the femoral anesthetic nerve can successfully performed, and she doesn't show any sense or pain reaction. At first, the use of nerve stimulator or ultrasound machine or drug delivery system is unfamiliar. According to the clinicians, and I don't know about your situation exactly, but everybody want no stress, particularly in our job, our anesthesia during surgery. Someone may think that there was no problem with the method so far. However, this may not be the case. For example, this man on the bike is familiar with his situation. While it may look weird to others' point of view, in my point of view, he needs a car. Of course, I don't know his situation, but in my lecture, the nerve stimulator and US ultrasound machine or the using of the drug delivery system may be the new way to building the car. And one thing I am certain is that the accurate application of local anesthesia will reduce the stress of your anesthesia task. Okay, my lecture is over. Oops.
Okay, thank you, Professor, for a very informative lecture. And for participant, students, or colleagues who may have any questions and would like to present your question in present, then you could raise your hand, or you could type your questions in the chat box and we will help to read them to the professor. If you're uncertain about the language, you could just use the Bahasa Indonesia and we will help to translate it to the professor.
First of all, I'm sorry my full English.
But we can hear your English clearly, so yeah.
I have a question. So in your clinics, do you have experience about nerve stimulator or US machine guided nerve block or drug delivery system?
So here we have actually the director of Airlangga University Animal Hospital, Dr. Ira. I'm not sure. I just joined the hospital, so maybe the more senior doctors probably have experienced them. I'm not sure. Prof. Wiwi Misako. Okay, probably they are unable to use
anybody here?
Yeah. Kolega yang hadir di sini mungkin ada yang pernah berpengalaman mencoba nerve block menggunakan ini nerve stimulator atau ultrasound guide. Just as far as I know, the ultrasound machine probably quite common in many clinics in Indonesia here, but I'm not sure about the nerve stimulator. I'm not sure if it's available.
Actually, I don't know your exact situation, so yeah, so I wonder about the situation. Is there? Do you have the small animal? What's your major between the small animal or large animal in your clinics? I don't know any situation. Yeah.
Okay, so many veterinarian in Indonesia here, actually in the university, the clinical department covers both small animal and large animal for the clinical science, right? But outside the local clinics, the vets, many are small animal practitioners, probably the one who attend this lecture. However, many are also practicing large animal medicine. And here we actually have one of the answer from the participant who says that he had no experience in performing the nerve stimulator guided or ultrasound guided local anesthesia. But I think this is a quite great information, and I'm sure many of the practitioners would like to try them after hearing your lecture.
Okay.
Okay, so any
Any question?
yes, any questions?
In USA, the older senior is typically use the blind technique for the local block, and freshmen of the board is typically used the ultrasound guide or nerve stimulator guided. So it's a neutral, and but I want to say I don't want to say the nerve stimulator or US guide nerve block is better than blind technique, and I just said local block is needed to the surgery and pain medicine and for the reducing the stress of anesthesia, because complete nerve block can make the stable and quiet status of patients during surgery. So the vitals is very stable.
Okay, so we have one question right here about the choice of the drugs that we use. So here, is the use of lidocaine will be safe enough for nerve block, or is it quite irritative for the tissue?
You means the lidocaine is safe?
Yes, because
Oh.
we have a quite limited choice for the medication.
Okay. Oh, okay. Almost almost cases the lidocaine, the use of lidocaine is stable, but in some cases, including intracameral injection or articular injection, at the times the use of lidocaine can cause the irritation, but almost all situation the lidocaine is very stable, and the local anesthetics can have the can cause the anti-inflammation effect. But I recommended the lidocaine duration is very short, so the use of bupivacaine is better for the post-operative pain management.
Okay, thank you for the answer, Professor. And we have another question. So I will help translate. Good morning. Thanks a lot with a remarkable lecture. I want to ask some question, but maybe I need a translator. So the use of local anesthesia, just like your explain before, seems to be really hard to perform, especially for really aggressive cat. Even using the general anesthesia, usually it takes quite a long time for them to, be out. And so is the use of local anesthesia would still need a general anesthesia or inhalation or other type of general anesthesia? Because seeing your slide, it seems that the animal is quite calm, And also another question is, how about the cost? And is this technique would require more expensive cost compared to the general anesthesia? Thank you.
Second question is about cost, and I don't understand exact the first question. Don't mean.
Yeah, okay. Basically, the first question is usually in cats, they quite aggressive. So
Aggressive
it seems to
cats,
be
yeah.
really hard to performing nerve block. So maybe, yeah. And
But,
also
okay.
in
In
certain
animals, the nerve block is typically performed under the general anesthesia. In my experience, the aggressive cat is usually observed during post-operative pain situation, and proper pain measurement can make the stable or calming situation after surgery. Well, sometimes sometimes we met the crazy cats at the times. Of course, after the use of local blocks, and we use the CRI of analgesics and sedatives combinations for the post-operative measurement. The answer is right?
I think your explanation is appropriate for the situation in Korea usually. So anyway, I think there is a